am really excited today to have three leaders in the field of aging life care management who are going to join us, and we are going to engage in a thought-provoking and informative discussion. These are some of my favorite discussions with aging life care managers. Um, Welcome to the three of you. Really looking forward to today's discussion. But before we dive into the details and start answering questions from our audience, let's get to know the three of you. And Samantha, how about if I start with you? Tell us a little bit about your background and your practice.
Thank you, Steve. Yes, hello. My name is Samantha McDaniel, and I am an aging life care manager, as you all know why I'm here. And so I am a solo practitioner, and I live in Anne Arundel County, but work and practice throughout the state of Maryland, and virtually too, if people need help from afar. So my company is called Aging Individualized. And I thought of that name because as probably everyone here has a different experience with their own aging or their loved ones aging, and just what you're going through, the hurdles you're facing. So I a little background on me. I worked in senior living for over 10 years and was really just itching to get into people's homes and to, um, get to help people, right from where they were. And see how I could impact change and give them the resources that they needed to be successful and age well however they wanted to do that. So yeah, so I'm so happy to be here,
I
and I
love
know
it.
we'll talk more about it.
I love it. And Leslie, I'll go to you next. Tell us a little bit about your background and your organization, which has a big anniversary coming up next year.
We had it last year, Steve.
Oh, I thought it
Uh,
was coming up next year for case care management.
oh, for care management, yes. I'm
Yeah,
thinking of our larger organization, but
yeah.
yeah. Um, my name's Leslie Mason. I'm a clinical manager with Seabury Care Management, and as we were saying, our program is part of a larger nonprofit, Seabury Resources for Aging, that provides different types of services for older adults and disabled adults in the DC metro area. I started with Seabury Care Management, which was Episcopal Senior Ministries back then in 2004. And came uh, I came to care management in a kind of roundabout way. I started my career out of college as a teacher, and then decided I wanted to go back to school in social work. So I did, and I was certain I was going to be working with children and families, and that was my clinical track. But you know what? Things just take a turn, and I um, was in the community working with children, and then switched over to the hospital setting, um, and worked with both older adults and pediatrics. And I remember being on my unit in the hospital in DC, and a care manager came up to the unit, wanted to speak with the social worker, and so we just started talking about our shared patient client, and she just told me a little bit about care management. I didn't know anything about it, and then I sort of scooted over to Seabury after that. But
I love
yeah,
it.
so I've been doing this for a while, and we are in our programs in DC, Montgomery County, most of PG County, and a little bit in Northern Virginia. So
I
we have a
love it.
good area.
And I tell you, I've done dozens of these roundtables now, and I can't tell you how many care managers, aging life care managers, came through the child. They started their profession in
Mhm.
uh, pediatrics and made the switch. So that's great. Okay, last but not least, Annette. tell us a little bit about your background and your organization.
Sure. My name is Annette Murphy, and I'm originally from Pennsylvania, but I am in New Jersey. My organization is a large nonprofit in New Jersey called Spring Point. I lead the division Spring Point at Home, and we've been in existence for 10 years. And we provide private duty skilled home care and aging life care advisors. So much like others, I came through this path because I started in healthcare, but it's been my entire career. I started in geriatrics in my undergraduate and in therapy, went into social work school, and my first internship, probably my first week, I had a client who had a guardian who was an aging life care advisor, and she was very active in the national level. We developed a relationship, and although I turned her down a few times for the position because I really wanted to stay within the hospital and healthcare system, once I finally got to a point that I realized I wanted the freedom to follow clients wherever they were and have more options, I joined her, and that was the best decision I ever made. So
Man,
here I am.
I love hearing these stories, y'all. It's great, and what an amazing profession that you all have chosen. And we're gonna dive in a little bit deeper to that. But Annette, since I'm with you, how about you take a crack for I know that we've got people in the audience that have never heard of aging life care. Somebody shared this link with them, and they want to know what the profession is and what the association is. And I'll drop some links in while you're chatting about this.
Fabulous. So, well, it's something I'm extremely passionate about because I've been on the New Jersey board and now I sit on the national board and have the privilege of meeting members all over the country and educating folks about it. Many folks refer to us as geriatric care managers. However, the proud distinction we have as the Aging Life Care Association is that that is a trademarked term. One cannot call themselves that aging life care advisor unless they are a member. And being a member means that they have been vetted. They're following our strict code of ethics, which bonds our like-minded professionals together. And they have to be a professional that meets certain standards. And even within the organization, if folks go to our website, they'll see there are various levels within the organization where folks can come in and be mentored, move up that career pathway. So that's an exciting piece of our organization to mentor up new leaders within.
Mhm.
I love it. And we always have folks that are on these calls that are looking at this as a profession. So we might get some questions
Yes.
like that today. Leslie and Samantha, anything to add in terms of before we move into the roundtable discussion related to the definition of your profession?
I mean, yes, I think part of what makes us unique, and in pieces, you see pieces of this in social work, which is my background, but we really are looking at the whole person, our client, their family system, the networks that they have. We are trying to help navigate different resources for the clients and sort of guide them through some informed decision making. So I sometimes like to think that we're kind of like the really big thinkers, but then we sort of make that care plan and we really dive into those details to really help our clients have a good quality of life.
So, uh, we've done a bunch of these, and we've had aging life care managers described as the wedding planners for growing older, the quarterbacks for growing older. I think last month, the wing man or wing person for growing older. I like those analogies. What I also like to do before we jump into the discussion is just recognize that uh, today you're talking to three aging life care managers that are in distinct markets that they serve. But when you go to the aging life care website, you click on this orange button here and you can search all over the country. So you just plug in your zip code here and hit find or your parents' zip code, and you'll bring up a list of a bunch of aging life care managers in your region. Um, Another thing that I want to share with y'all, and actually, this might be a good thing for one of you to comment on before we jump in, is the 8 knowledge areas of aging life care managers. This sort of speaks to what you're all have been talking about, is this holistic viewpoint of your profession. Um, so anyways, that I'm just sharing that for reference. So okay. All right. Well, let's jump into our discussion. And again, I'm going to remind folks, you can ask questions at any point in time by using chat or Q&A. But let me go back to where I started with Samantha. Samantha, what's on your mind these days? What would you like to share with our community?
Yeah, so I wanted to bring up something that, I'm noticing more and more in what I'm sort of getting called in for. And I will note that, my background is primarily in dementia care, and, working with people with dementia and their families, kind of, working through that. And so I've noticed that I'm getting these calls that, I got a call the other day, and actually the man said, "If you can crack this nut, this will be the case of your career." And I said, "Okay, let me see what I can do." Because I just came into the house and basically mom, she was living with zero quality of life. Was starting to become afraid to get into the shower, calling the ambulance 4 to 5 days a week. And it was just to have someone come and check on her. There was a lot of psychosomatic stuff going on there. And so, we had these real conversations, and I would say she was moderate, mid-stage dementia, but real conversations in the moment of, how is your life looking to you? What do you wake up for in the morning? And, ultimately, not even that long, she decided on her own to go and try out an assisted living for respite. And she loves it. She has a boyfriend, things are great. But I think that situations like this, where the son had been trying and trying and trying to get her to do something, to make some change in her life, and just didn't know where to start or how to talk to her, and was confused because, okay, this is my mom, but this is my mom with dementia, and didn't know how to kind of intertwine the two. So that was a very specific example, but just to say that I am seeing more and more these, okay, I need to make a change in my house or at my mom's house or my dad's or my parents, but I just don't know what to do. I don't know how to start the conversation, or mom and dad doesn't want to listen to me. So I also think aging life care managers are really great mediators and facilitators to be that, knowledgeable and objective person at that first visit too. And of course, they can kind of be along for the ride, but even for local families that are really involved, it can just be a really great resource to kind of kickstart a change. So yeah, that's
Love it.
a little
No,
story I
that's
wanted to
great.
share. It's
Um,
seeing it more and more.
yeah, and Leslie and Annette, before I move to Leslie, any any insights? Are you all seeing this similar scenario in your all's practice, and any insights that you have?
Yes, I would say we see that quite often, and we do a lot of what I would call caregiver coaching in those situations. We also have a blog writer that writes for us, but she's part of a different organization that is caregivers, lay caregivers trained to be caregiver lay coaches. And we give her book out for free to caregivers too, who order her audiobook if that's something that they want to avail themselves. But I think what Samantha's hitting the nail on the head is that sometimes how to start and shape those difficult conversations is a skill set that care managers have. But also sometimes it's just that we don't have a magic wand, but having the conversation from someone who's not your adult child shifts the feeling of pressure or shifts the dynamic just ever so slightly. So I think yeah, I think we're seeing the same what Samantha is.
Yeah, and I like what you said in that, because I like how you framed it, caregiver coaching, because
Mhm.
sometimes, I mean, Samantha's client was amazing. You got to actually go and see mom. Sometimes nobody is allowed in, and so you're coaching the children or the next door neighbor on how to communicate with the parents. So man, great insights. Leslie, any insights on this topic before we jump to you?
Yeah, I was gonna, piggyback on what Annette was saying was that sometimes just having a neutral third party who has no skin in the game, can can really start that conversation. The other piece is too is we facilitate a few caregiver support groups, and sometimes I really like to refer adult children to those types of support groups because they are not the first people who have had these concerns, and other people have figured out some strategies on how to, approach their parents, and so we can really learn a lot from each other. So I thought that sometimes is
Wow.
helpful.
All right. Well, Leslie, I'm going to go to you next because I want you to hear your thoughts. But before we do, I had a great question from Linda, and I think everybody on this call has experienced this. But let's do a little brainstorming to maybe help Linda out. Linda says, "What strategies do you have for placing an older adult in an assisted living community or memory care when they need it, but they don't want to go willingly?" And I think Samantha, I liked how you were able to have this dialogue where, however, it happened, the older adult made that decision, and I like suggesting respite. That's really good. So Linda, think about that.
Yeah, I was just going to add to that. I think that, of course, it has this connotation of being, oh, this is, where I'm going to go to die, I'm going to be locked up there, all these things. But I think that, kind of going back to the basics too, in pro and con list, and really having that conversation of what your quality of life looks like in your home compared to what it could look like. I think just painting a really positive picture of this is what could be. And it's not always, it's not going to be that cut and dry, or it's going to be different in everyone's situation and what they have at stake. But um, kind of the positive side of things and how it can really help you regain your independence, because people look at it as stripping independence.
Giving it away. Yeah.
Um, but giving them more autonomy to be able to do what they can still do without having to worry about all the dangers in the home and
Yeah.
the isolation in the home, all of these pieces.
Yeah.
I love that. Leslie, Annette, anything to
Yeah.
add here to help our friend Linda?
I would say much going back to our previous conversation about us being the neutral mediator. Sometimes families and others assume that it has to be assisted living, but by us coming in and doing a full evaluation and laying out the pros and cons, sometimes care could be appropriately provided at home and creating an assisted living of sorts at home and the socialization. And depending on that person's personality, sometimes folks expect them to be a joiner and go there for socialization, and that's not going to be them, even if you move them. Looking at the whole picture, but also I always use as my social work background that motivational interviewing, because like I think Samantha was touching on that with figure out what motivates that person so that they have interest. For some clients, it's literally the finances that has tipped the scale for us when we show this is what it costs to maintain your house versus moving in there. Other times it is that social aspect. It really just depends. But sometimes we take folks for lunch at a place to break down barriers and give them a new concept. So it's as unique as the person, but finding out where they're motivated and what makes sense to them. Yeah. Leslie,
Yeah.
sorry, are we going to add as well?
Yeah, I was going to say I have this situation right now, so I can really relate with a client. And I've kind of like hanging in there, just trying to put in resources whenever possible, to and meeting the client where they're at. They want to stay home. So is that possible? What can we put in place? Reaching out to their network to see who may have some influence in their lives, whether it's their, 20-year primary care physician, that utilizing that relationship. Um, Sometimes we just have to let the process happen, unfortunately, and somehow we might get to assisted living in a way we don't want for our client. But trying to really honor what they want and go through the process and trying to keep people as safe as possible is what I've been trying anyway, with
I
current.
love it. I love it. And the another thing, Linda, is make a list of all the things that your loved one is interested in. And when you go to visit the community, we'll give the list of those things before you go and say, hey, it would be great if you could find residents that might be interested in the same thing, because that oftentimes can be a draw. It's sort of like mom's alone right now with nobody that likes to collect Beanie Babies. And now she's going to be hanging out all day long with some of her buddies that like to collect Beanie Babies. So, anyways, all right. I'll jump back to the questions here in a moment, but Leslie, what ideas and concepts would you like to share with us today?
Yeah, this is a little bit different and off the path a little bit, but we at Seabury, we answer an information and referral line, and I feel like we're getting a lot of calls recently, and we have clients who have young onset dementia, whether it's an Alzheimer's form, whether it's due to any other health issues, and we're really having to be creative and really try to figure out what kind of resources can we put in place for this population, which is increasing, but they don't quite always fit into the resources we have for older adults, but they don't really fit into those resources for middle age adults. So what can we do to help that population, give them support, give their family support? We've really been working with that. I feel like quite a bit. And it is really tough because your heart breaks to see someone who's younger really having those struggles that you've seen over the years with your older clients and really not having the resources there. So I really like trying to creative problem solve whenever I can, but it can really get difficult. And so that's why I really like to reach out to the community to see how we can all work together, because this is going to be an increasing problem.
And I'm glad you brought this up, because a lot of times the topics that we talk about here, we think that they're age related, and we're all of us are aging. If we're alive, we're aging, but through our life, we have various accidents, healthcare challenges, life changes, loss, this, that, and the other. And the fact that care management is not necessarily exclusive to age can be supportive to disabilities and life changes. So
Absolutely.
thanks for sharing that. Also, something I know on this tangent, uh, there are many people that have children who have disabilities, and they are the caregiver for that child for life. And physically, that becomes challenging. And I've seen some situations where aging life care managers are called in when we're taking care of our uh, adults with disabilities. So,
Yeah.
We
okay.
have that too.
Um,
Yeah,
Yeah,
I
definitely.
I was gonna say, I'll add to that real quick that sometimes we're not just taking care of one client. One thing we see more of, and I have clients right now and have had quite a few over the years, where we're called in for the elder who has some crisis, but they have an adult child with disability needs that lives in their home, and we're needed to manage unique resources and placement, and it's managing on each end of that age spectrum. So, yeah.
I love it. All right, folks, keep the questions coming in. I'll get to them here, but I want to make sure that we give Annette a chance to sort of give us another topic for discussion and thought today. Annette, what's on your mind?
Sure. Well, I'll tell you about an exciting project I'm working on with my team and trying to roll out for other care managers, and that is crisis emergency planning. It's something because my organization has the home care side in New Jersey. We're required within 24 hours of every client doing an evacuation plan. And clients often look at me like, what? We don't live in a hurricane zone. Why would I need to do that? The list goes on. And I say, look, in all the years I've been doing this, I've evacuated people from their homes for all sorts of reasons. And I myself had damage to my home. I was at ground zero for FEMA in a hurricane, which is partly what amped up my desire to make this even stronger. And as I added more team members in my own team, some of my care managers have backgrounds in rec therapy, some are nurses, some are social workers, gerontologists. We all have slightly different perspective of how we organize things. So we started a custom kit that we work with the clients to, especially those who are solo elders that rely on us, and especially who are in their own home, where we work through where's the water shut off. So if there's an emergency and you call the care manager or someone else, we already know how to act quickly. Who's going to shovel the snow? But also down to a to-go bag that has a laminated list of who to call for road closures, where to go, what to pack, and copies of those emergency papers that we all need to prove who we are if there's an emergency. So it's a really robust kit. But really, I saw it not only as the emergency planning we do for our clients, but I saw it as a gift to the next of kin. Because sometimes a care manager, we have things in our electronic medical record, or we have things in our heads about our client, but there's family out of state or others who, when things come, push comes to shove, they need a next of kin box that really just says, here's where everything else is kept, and this is the roadmap. So I see it as a big gift of peace of mind, which is what all the things we've been talking about today is really giving folks a pathway, a roadmap, and a peace of mind.
Man, I love it. And in all these discussions that we have had, I've never heard anybody bringing up the emergency prep, and I think that's a great initiative for your organization and one to roll out, system wide
Mhm.
amongst care managers.
Mhm.
I think about just in the summer when we have power outages and we have older adults in high rises with no air conditioning, and in the winter when you have a snowstorm and somebody is stuck. I mean, those are emergency situations for an older adult, you know. So, okay. Tina has a heart-wrenching challenge that let's see if we can do some brainstorming around. She says, my mom has verbally been threatening me. I have, she is working with with a senior care social worker, but it's really scary and her own doctor doesn't want to be involved. Any words of wisdom for Tina? And I realize there's probably more to this, like Tina, but we'll do our best to kind of just brainstorm with you on some paths that you may or may not have gone down.
Mhm. I was going to say, it sounds quite complex, so it may seem superficial for some of the pieces we'll recommend. So Tina, you kind of chime in if there's other pieces you want us to really be more as specific we can, or even consult with us after today's call. But for some clients, like your mom situation, in our area, we look for home visiting doctors. Sometimes getting a home visiting doctor makes things less aggravating for either what I call behavioral expressions, her acting out, her saying those things to you, um, and then going from there. It varies from a home visiting physician who says to us, look, I'm going to start documenting that maybe they need guardianship. Maybe they're not making good decisions for themselves, or they're at harm or at risk themselves. Maybe they need that home visiting physician to then start documenting or call crisis and psychiatric crisis to come have the person stabilized. Or is it something that is benign and she says those things, but she's not a harm to herself, others, and she's fully competent? But sometimes having those services and care practitioners, I know on our team, much like the diagram Steve put up before, is excellent. That little hub, whatever you call it, quarterback or otherwise, I always say we're not the doctor, we're not the lawyer, but we can bring other services into the home or meet her where she's at. And again, I will go back to another premise that someone mentioned earlier of go with their trusted advisors. Whenever I'm problem solving with a challenging client about can we even go to the house, what path do we take, and clients will call in like yourself and say, Mom won't even open the door for you. we start talking about, well, who is the trusted advisor? I had one client that was the challenge. She had no family. The trusted advisor was the pharmacist down the street and the mailman, and that's who we leveraged. Another lady like this, the person, she no longer had a relationship with a senior center, but she still talked fondly about them. So that's who we leveraged. And we called them and enlisted a little help to go to her. So whatever little leverage of who the trusted advisor is, that sometimes is the person you start with. So
Great suggestions.
mm,
Any other thoughts for Tina? One thing with dementia, we have a lot of dementia thought leaders, Tina, on these discussions, and they all say the same thing. You can't argue with somebody with dementia. And oftentimes, if somebody has a dementia diagnosis, their aggressive nature is because somebody's telling them they can't do something, or they're asking questions, or they're arguing. I don't know if that plays any role in
mm,
this.
Another piece I wanted to jump in on is I don't know if Tina lives with the parent. I might have missed that piece. But I agree with totally with what Annette was saying about trying to leverage relationships, bring people into the home to see if they can problem solve and try to help in some way. But I also really think a lot about, I mean, you, Tina, about the caregiver, and it's difficult, it's scary at times. Is there a way that you can enlist some of those, trusted people to kind of jump in for you so you can take a respite. Or if you have the ability to talk this through, with someone you trust, or a psychotherapist, or a caregiver support group, really trying to figure out ways to take care of you. Because, if you're not taking care of yourself, this is going to magnify even more than it really is. And it sounds really difficult.
yeah. Good
Right.
advice. And I was going to say, Tina, we even have that with professional caregivers. Sometimes someone with dementia latches on for whatever reason to one of my care managers or a home health aide, and it may not be rational at all of anything they've done or said, or it may just be how they look that day. And we have to leverage somebody else and some other new approach and a new fresh face. So I saw you in the chat had put your family recommends for your safety. Maybe you don't go. It may not be. If your presence is triggering for both of you, it may be leveraging someone else at this point in time in her journey.
Yeah. So
Yeah.
yeah, Tina, hope that's helpful. And if you can maybe talk to a few care managers in your community, perhaps they could help. So hopefully we gave you some good ideas here. Now,
Mm.
Angie, shifting gears, Angie says, what recommendations do you have for someone who would like to become a care manager? Um, uh, we love questions like this.
Well, is it become a care manager or is new in the field? I just want to make sure we get the
She wants to
differentiation
get
for.
started, or
Oh, she
just
wants to
getting.
get started.
How about let's do both? Is just you know getting started, or yeah, yeah. How do you become a care manager?
I would say, Samantha, were you going to answer it?
No, I think my veteran friends should start with this one, I think.
So in the field of aging life care, or at least in our organization, it's a professional basis. So we have folks from different backgrounds, but they start with an educational background. So the pathway is a little different depending on that person's credentials. So for example, someone who has an RN degree or has a master's in social work, it's a little faster pathway to be mentored into the association and the different levels. I know there are newer membership categories that the association has looked at so that folks who don't fit in those traditional education backgrounds have some opportunities within the organization. So for example, we had an educational membership for folks to not be listed on the website to search for folks for that level of service, but to get the information and get educated. NACM, the National Association of Certified Care Managers, is what many of our members get their credentialing as a certified care manager, become members. And Steve's answering the piece. I was going to say, if you can post it there, there's all kinds of wonderful information on the national website about those membership levels and how someone could follow through on that. But those of us in it love, I have an intern sitting on the other side of the door now. We love mentoring new folks into this exciting field. So thank you
I
for
love it. And I love how there's so many times we get folks tuning into these just to get a glimpse of the profession. And so thank you and good luck with that. Okay. Um let me see here. Dean says, I volunteer for a memory cafe at my church. We're a branch of Fences, an organization focused on dementia. We play bingo with clients. I went shopping for gifts for the winners, and I found puzzles that are recommended for persons with dementia. Well, first off, Gene, thanks for sharing that resource. And maybe I'll like this is actually kind of a good one. Like, what are some of the tools out there that our community members might not be aware of that you all have had some success with your clients? That might be fun.
It's fun. Can I tell you a new one? I was going to say, and I'm sure Samantha's into
Absolutely.
specialized dementia. So unfortunately, my own mother-in-law passed away from dementia last month. I'll try not to get emotional talking about it because it's fresh. But even as a care manager, knowing what to do and seeing this coming, our conversations over the years were getting more challenging because she was what I would call an ostrich. Like she wanted to put her head in the sand. She didn't like making decisions. She did make some of the key ones needed, and I knew her wishes. However, I couldn't be her care manager. She's my ex-husband's mom. She's at a distance. So I hired another care manager, and that was the biggest gift ever. And I tell clients this because I have clients all the time who are brilliant scientists and professors and otherwise, and they say, I'm so smart, I can research all this, I can do it. The overall message is that no one can do it alone, and there isn't one magic little resource. Dementia looks different, and caregiving looks different behind every closed door. But I will tell you the one tool that gave me peace of mind. It's actually I have it sitting here, but it's called Sociavi or Care 360. It's designed, it has activities that caregivers can be trained to do. It tracks how someone does the activities and makes it harder as it goes along for social engagement. But for me, at the far end of the spectrum, it was a huge gift because she was on hospice at the very end and I had to go away for a week. And I was so worried about she couldn't answer a phone. The staff weren't there to answer the phone. She was then in a facility. So this device has loudspeakers and it sits on the table and the person doesn't have to know how to use technology at all. I just popped in on her screen and say, hey, we're here, and we'd have a little chat. We'd send her videos that on it. It had a picture slide screen, but it was beautiful for her because we often think of technology as something that the other person has to pick up and hold and touch and engage. But this way, when we were away for that week, we could talk to her and have wonderful conversations and send her updates as we were away. And that was a huge gift. I can't thank Paula Mueller who developed this enough for she ran right over and set it up that Saturday I was leaving. And yeah, because connection means a lot to all of us, no matter
And
where your
and
loved one is.
and this is called oh, okay, I got it.
Find it?
CareLink 360.
You got it.
Mhm.
Yeah.
CareLink 360. Okay. I'll drop that into chat, y'all. Um okay. Any other things in the spirit of games, techniques, or products that have worked for any of your clients?
Not specifically with a game or a product, but one thing I wanted to, at least talk about with our group and lots of other care management agencies maybe have something of this type, but we have a life enrichment program because as care managers, sometimes as we're looking at the big picture, we understand that our clients are lonely, they lack the social engagement. They may have issues that make it difficult for them to leave their home or their environment. And so we do have specialized staff who come from a variety of backgrounds who really just spend time with our clients doing whatever brings them joy. And that might be playing Uno every week. It may be having a book club. It may be going downtown DC and looking at the monuments. So, sometimes companions can do that as well, but those are sometimes people that we don't think about right away. Just someone who can really kind of come up with a plan on how to provide that engagement.
Love it. Okay, a few more questions about becoming a care manager. Um, Christine says, I looked up getting certified. However, it looks like you need to already be an RN or social worker. Would love to learn if there's other ways that you could become certified.
It is confusing. It is. When you look up all the differentiations on the ALCA website and the NACCM, to really kind of get in there. But I think the main thing, because I'm not a social worker, my background is in music therapy. But then I, moved into a supervisory role of caregivers, in the continuing care setting. So my background and I guess and education, all these different, it's basically like ticking boxes to add up to, being able to have that knowledge and background to be able to do the work. So I think what a good place to really start, in my opinion, as many wonderful resources as ALCA have, you need to have that care manager experience first. That I found it really helpful. I reached out to the certification board for clarity. And I don't know if you two agree with that or think she should just go straight to ALCA. But they offered me a lot of help of just, this is what I got. Is this enough? What do I need to do? They were just very helpful at the NACCM that to have the CMC certification. So I don't know if you two have any thoughts, because it is confusing. Don't feel bad.
I would say I always call Sarah. She's the Sarah Falconer at the national office. She does membership for years. And Julie Wagner, our CEO of ALCA, is also on the NACM board. So whichever office you call, they are extremely knowledgeable about each other of how the certification works. When I've had folks approach me here in New Jersey and say, do you think I can be a member? And if it's not really clear to me, I always reach out to them and we figure it out, because even because sometimes there are folks, like you said, they either need to get mentored and work in that field, or we've had folks where maybe they become an educational partner or other partner and really experience it that way. But yeah, I don't pretend to have all the answers with it. And you're right. And so sometimes, like, if the path doesn't fit in the little checkbox, you gotta dig a little deeper.
All right. Allison finally broke the dam. We've never hosted one of these without the question. As I was wondering, what is the fee range that are you seeing for the cost of aging life care managers? And so I know this is a hard question to answer because of different geographic areas, but maybe talk a little bit about how most aging life care managers charge, and uh, folks are always curious about that.
I think, as you were saying, it really varies within, the area that you're in. And it also may vary with, are you a company? Are you a nonprofit? Are you a solo practitioner? So I think that, can add to it. I know in kind of the DC metro area, you may see anywhere from $170 an hour to even $230 an hour, give or take. But then you do have some solo practitioners who may charge less, and there's, trade-offs for that as well. So if that's, I don't know if that's helpful for at least this
Yeah,
area.
and most practices charge an hourly rate, correct?
Yes.
That is
Yes.
the model.
Correct.
One thing, the name of the person, Allison. One thing, Allison, because I've done 12 of these so far. This question comes up every time. One thing on cost with aging life care, elder law, daily money managers, is that if your first consultations are free, like they're looking to see if it's a match. And it's important to bring this up in that initial consultation. But every case manager that I've ever care manager I've ever talked to said, we try to work within the limits of the budget of the client. And sometimes it might be just a couple of hours of coaching is helping the family get through the door within their budget, whereas others are like, look, I'm in California, mom is in Florida. I need you to take the reins on this one.
Mhm.
Um,
Yeah.
and
Yeah.
I also think, as a solo practitioner, that, yeah, the answer is just not cookie cutter because, a lot of times as a full-on care manager, like you're saying, Steve, I'm here, they're there. The need of the person is going to be different. So I might do a 12-hour monthly retainer. So they're paying to kind of keep me. So I'm there multiple times a week for someone who lives in the home, but might do only a 5-hour retainer for someone who's in an assisted living and has just a overall blanket care. So I have a fee sheet that I think every time I say, but for you, it might look more like this, right? So it's kind of it's hard for a blanket statement, but I know that range that Leslie, gave. So are most taking a retainer?
Yeah. So
yeah.
Allison's question
And
was about retainer. Not all do. I know it depends sometimes on your practice. Like for me, because we're nonprofit and I have a income stream coming also from home care, I don't always have to take a retainer. Many times then it's not a barrier, but oftentimes a retainer for say solo practitioners is often maybe needed because they have to have that stability of income. So it differs. There's no one set answer to it. But back to Samantha's statement about a little or as much as you need, we've had clients where I say, look, they think maybe it looks expensive to them, but I say if you're having a home health aide and you're spending a 6-hour day minimum, a one-time consult with us where we can write out a solid care plan, have a family meeting on it. Sometimes families can take the parts and say, okay, we can run with this. It doesn't have to lock someone into a long-term agreement. Sometimes it's as simple as just an assessment and tell you where to take the roadmap from there. So, yeah.
Yeah.
all right, now I knew this question was coming from Lee. Are care management fees covered by long-term care insurance? But I'll tell you something, Lee, and I love our care managers to comment on this. Having a care manager, if you have a long-term care insurance policy, it's great. It's a great resource to help you review that policy
Mhm.
and make sure that you're taking advantage. But I'd love your all's insights on long-term care to pay for your services, but then also how you help people with their policies.
I feel like we've maybe had it very, very infrequently where we're covered through long-term care insurance, but it's been possible. Uh, One way that even with a client I have now, I've been working with her long-term care policy. She has a POA who's an attorney who's like, please take this on. So it's a matter of helping the client call and helping to set up a claim and keeping track of, eligibility dates. So I feel like that's an area where care managers really can help because it can feel really overwhelming or trying to understand what the policy says. I think we can be a really good resource for that.
Mhm. Yeah. I would say just bring up the policy because I actually have one here on
Yeah.
my desk I was reviewing today for a new client. They sometimes cover for medical management, but I don't ever give the answer of no, they won't. I like to see the policy, call, and at least have them inquire and start the process. So from the beginning, even if we don't think we're using it right now, that we know what the playing field looks like and keep track of what their policy is because they're all so different. And also sometimes people think they have a policy and it lapsed. So I just like to review it right off the start. It avoids a lot of confusion later. Yeah.
No, no, I love it. All right. I'm always blown away at how fast we burn through an hour. We've got a few minutes together, and I wanted to make sure that is there any topics or things that we didn't discuss today that that you as panel members would like to get out there to our community. And then whenever I say that we've burned through an hour, I always get more questions. So while you're thinking about that, I'm sure some more are going to come in. Oh, and here we go.
See
From
that question,
Julie,
Julie?
if I retain an aging life care manager for a friend who I've long looked after, would that person work for me or the family that is starting to surface as my friend ages with lots of opinions? Wow. I love this question, Julie, because it sets us up for a very important thing about aging life care managers.
It does. And that's a complex question I get from every new employee I hire or a new mentor because we deal as the hub in family systems, and family systems is chosen family and neighbors and others, right? It sometimes gets a little muddy as far as like, hey, who's the client actually? The client is always that elder, as I always say, for clarity, regardless of who's paying the bill. So if your dear friend, even if you brought us in, says, I don't want certain things shared with that dear friend, or otherwise, then it's not. That person is always at the center of the focus. And sometimes that's a careful balance we walk because even with families, I have families who are sometimes very strong and they call and they think we're going to make mom or dad do the very thing they didn't. Everything from they suddenly are going to eat organic and eat whole foods every day and be social when they weren't. I mean, the list goes on, but it's walking that careful balance with everyone that really the identified person that we're focusing on is that client themselves. That's always our ethical principle. So I hope that answers it in a succinct way as possible. Yeah.
I love it. Yeah, that is, and a lot of times I know from talking to y'all, it's sort of like I want mom to move to an assisted living, so I'm going to hire a care manager and she's going to do it. But that's not the client, that the person that you're working for, that may or may not be their desire. So,
Yeah.
um,
Yeah.
um, let's see. Dean asks, I was late tuning in. Annette, are you located? Okay, here, let's just go around the horn on where everybody is located. So, Annette, your region is New Jersey,
Mhm.
Pennsylvania, the
Yes.
Philadelphia, New York metro areas, or
We don't go into New York, but all
oh,
of most all of New Jersey and some of
okay.
Pennsylvania. Mhm.
And then Leslie, your regions that you serve?
We're in DC, Washington, DC. We're in Montgomery County, Maryland. We are in much of Prince George's County, not all, and some work in Northern Virginia.
Okay, and then Samantha, your primary areas?
Primary, Anne Arundel County, Howard County, Baltimore County, and Montgomery and PG. So kind of central Maryland.
Cool. And then, Dean, just as a reminder, because you did tune in late, and I did this right at the beginning, when you go to the Aging Life Care website, you can click on Find an Aging Life Care Expert. You can type in the zip code of any place that where you or your loved one
It's
is. Well, look at that. I got
Wow.
Samantha on the first shot there. Um, and then it will bring up the aging life care managers in your region. And just, I mean, actually, the cool thing about this roundtable is really what I think we would all recommend that people do when you feel like you would like the services of an aging life care manager. Talk to two or three and take advantage of the free initial consultation and figure out who you gel with best and then go down that road. So hopefully that's helpful. So okay. Thank you, Mr. Gurney. I'm still confused at who Mr. Gurney is. I think that's my dad. Yeah. So, anyways, this has been great, y'all. I thank you so much for sharing with us today. Once again, thank you to our audience. You all blow me away. Like the questions that come in on these discussions, I could have never have dreamed them up, and it really makes it an authentic, interesting conversation.
Well, Steve, thanks for hosting us with this. I love it. I love learning from my colleagues. I love hearing the questions from the audience. It's fun. So thank you. It really is.
Excellent.
Thank you for
All
including.
right, y'all. Well, have a great week. I will follow up. This recording will be online. All of our panel members' contact info and websites will be there. All of this chat dialogue will be there.
Mhm.
And then we'll see you next month at the next Aging Life Care Roundtable. All right.
Oh, awesome.